can definitely integrate that into our conversation today. So yeah, thanks Wade for the intro. Um, a lot of this pretty self-explanatory, but I do want to highlight. I love to soak up lots of information. I've done well over 1,000 interviews now, one-on-one with folks. Some of them being AI experts, some of them being AI advocates, some of them being AI doomsayers, and everywhere in the middle to really understand, from folks that maybe they're hesitant to use AI, what's holding them back, or people that have really gone all in with AI and understanding what are the big wins, what are the big fails. And so what I've done today is really distilled a lot of that information in a way that you can hopefully learn from other people's successes as well as other people's mistakes. So based on the survey that everyone's completed, it looks like we've got folks from a whole bunch of different areas. Looks like actually no one's selected actively avoiding it. So it's a little bit surprising, but good to hear. Definitely understanding that a lot of folks are seeing the big benefits, or at least hearing that there's big benefits, and doing some level of experimentation, whether they're all in or not. So that really helps me kind of give an idea of how I can frame the conversation with you today. So let's see here. Looking at what you're going to be leaving today with. So I do want to make some promises for the next hour. So I do want to make sure, hey, you're going to walk away with a really clear understanding. How can we adopt AI in a HIPAA compliant manner? Not vague advice, but some actual criteria that you can use really starting today. Two, you're also going to walk away with an understanding of what's been called AI failure modes. Oftentimes, AI, when it breaks in very specific, very predictable ways. So, really, once you know what to watch out for, it becomes a lot less scary. And then three, we are going to be raising some awareness of bias as it exists within AI. And that's specifically when it's interacting with mental health content and tasks. There can be some really unique circumstances that present themselves that just by being aware of those, you can really avoid potentially a lot of harm. Since AI can really amplify some pretty harmful stereotypes in ways that are pretty hard to catch. So really excited to show you both how to keep your eyes peeled for some of that bias, but also even how to prevent it in the first place when you're using these AI tools, whether it's a chat GPT, Gemini, Bastion GPT, really you name it. And then the fourth item that you're going to walk away with is an understanding of some of the top workflows that meet two goals. So one is consistently transformative for folks who use it. Things that, hey, because of this, I've been able to get home and play with my kids more, or the quality of the client care that I'm providing is increased. It can both do that, as well as it's something that you can start using pretty early into your AI journey. There's some tasks that you really don't want to start using until you've got a solid 6 months of AI under your belt. But everything we're going to be talking about today is going to be things that you can use pretty early into your AI journey. So maybe drafting some progress notes or DAP notes, patient communications. If you hate prior authorizations, those types of things, we'll show you how you can use AI to help you with some of those. And these are going to be real use cases and some specific guidance on some of the key items there. So we do have a lot of ground to cover, but definitely don't worry if there's something that doesn't quite click as we go through the program. Feel free to again raise a question here, or I have my contact information at the very end. So I'm happy to help you either personally, or I can point you some other resources that can make sure you're well equipped to go into your AI journey. But first off, before we talk about deeper in AI, things like safety, really want to make sure we're all working from the same mental model. So you really have a clear understanding, consistent understanding of what this technology actually is, since there is so many misconceptions floating around. So when you talk about generative AI or large language models or LLMs, these are all pretty synonymous. Think ChatGPT, Claude, Gemini, Grok, all of the different AIs that are popping up within your client management systems or your electronic health records. They work essentially by predicting the most likely next word. And so that's it. That's really the core mechanism. They, in general, they're not retrieving facts from a database. They're not looking things up. They're really just generating plausible sounding text. So basically, everything that the AI tells you, totally making it up. Now, the thing is, it's so good at making stuff up that the vast majority of the time, it actually makes up the truth. So, really, really cool effect. But definitely understand that this is fundamentally very different from the way most all the other software that you use, which is going to be following very explicit step by step deterministic rules. Traditional software, it's going to do exactly what it's programmed to do. Generative AI, though, it's really going to predict what you want based on some guesses. So the example that I like to use with clinicians, particularly with folks who are really struggling to wrestle with how do I interact with this AI? What do I trust? Is I really like to think of generative AI as a very book smart, overeager intern. It's their first day working for you. He is dead set on giving you the answer that you want. Though sometimes he's going to make stuff up, and sometimes he'll occasionally come to work drunk. So something that, you definitely wouldn't put a person like that directly in front of a patient or a client without some guardrails or some screening. So similarly, that's kind of the state of this generative AI technology as it exists today. They can do amazing things. It can memorize insurance documents. It can in seconds. It can memorize Waze protocols. It can memorize, produce, solid first drafts of progress notes or prior auths. But ultimately, you should ask yourself, would you sign something that an intern wrote without reading it? Likely not, particularly as we kind of go over some of these failure modes. Some things to keep in mind as you're using the technology. So you'd review it, you'd make some occasional corrections to it, you'd make sure, hey, ultimately this reflects your own clinical judgment, and then you put it out there, you put your name under it. So that's really exactly the relationship that we're looking to have with generative AI today. Technology, it's getting smarter every day. Who knows? In a year from now, maybe we'll have FDA certified AI that can help you, actually perform actual diagnoses. But the technology is definitely not there yet, and so we are huge advocates of getting that human in the loop of making sure that AI is an assistant for you and definitely not a replacement for any of your clinical skills. So let's start with some of the security and privacy fundamentals before we get into some of the workflow items, use cases, and things like that. Because if you get the security and privacy piece wrong, really nothing else matters. A HIPAA violation, a data breach, client data that's used to train a public AI model, really any of those can be devastating your practice, devastating your reputation, your clients. So I really want to make sure everyone starts with a really solid foundation. And one of the easiest things to kind of wrap your mind around is the business associate agreement. One of the quickest way to kind of filter out any AI solutions that might not be a good fit for you is, hey, can you sign a HIPAA BAA? And basically what that document is, it's a legally binding promise from that company to protect your data to a certain standard. And in most all cases, that's going to be a HIPAA requirement. So you might notice there I've got a little tiny asterisk next to that. There are some scenarios where you technically don't need a BAA, whether if you have an existing different type of relationship or your cash pay in certain scenarios and not interacting with federal programs. But even if there was a corner case where you don't need a HIPAA BAA, in most all cases, we still recommend, hey, you want to make sure you've got these promises from your AI vendors. So even if you don't technically need one, in most all cases, we recommend still going forward and making sure that that person can, or those solutions can provide that protection. So yeah, if that AI vendor won't sign a BAA with you, you really can't be using that tool with any protected health information, no client data. And that definitely is a big signal that that tool isn't designed to be used with all of the unique needs that come with healthcare and mental health workflows. The data that you have access to, if that were to be posted out there on the internet, that could really destroy your clients. So we really have to hold ourselves to a high standard and really be really picky about who we trust. Yeah, I mentioned I've got well over a decade of experience working with some of these on some of these scenarios, working with organizations clean up from data breaches, and I have seen devastation. I have seen clients that have had their data breached. The hackers reach out to their patients and say, "Hey, I've got your therapy notes. I'm going to sell this on the dark web unless you pay me this particular Bitcoin." Or, hey, we hacked into your OB-GYN and your MRI scans, and we're going to post this, we're going to show this to the world or your family if you don't pay us money. So um, nightmare scenarios, which is why it's really important that you be really vigilant about some of the data that you're giving some of these systems. So within those agreements, there's some things that you want to look out for. One of the big things is if you notice, hey, they haven't updated their HIPAA BAA or their terms of use in 5 years, then there's a really good chance that they're missing some pretty critical protections. So definitely something that could go towards disqualifying them. Um, One of the things that you can look for is to see how they're using your data. So AI is very expensive to run, especially if you're using clinical grade AI. So an AI that you would expect to be able to help with some of your mental health workflows. So if you aren't paying for their services, then you aren't their customer, you are their product. And this is really not just the case with basic consumer AI tools. There's even some companies out there that are marketing to healthcare, and they're doing really two very naughty things with your data. One is they're using your data to train their AI models, and the vast majority of your clients, they don't want their private session content being used to influence outputs that other people are going to see. So you really want to make sure your agreements don't let other companies train on your data. The other naughty thing that they're doing is they're often reselling your data to companies who want to use it for other purposes. This could be research studies, market research, targeted advertising, or even other companies who want to use it to build AI models. So some really scary stuff, super important to keep in mind because there is some really big money in selling this data. So you really have to keep a sharp eye out for all of that. So another thing to look out for when you're partnering with some of these vendors is make sure that if they do have a breach, that they're going to notify you, period. But they also do that in a timely manner, and that they give you all the support and information that you're going to need to handle that breach. So certainly we all hope that we never have to deal with one, but I know like most of us in this room, we've probably gotten that letter that says, hey, your health information has been compromised from some breach or another. So you want to make sure you're minimizing the stress and anxiety that you're feeling, as well as those from your clients. The third item here, you really want to make sure you understand with your AI tools some of the data retention and the deletion promises. So it's how long are they going to keep your data? Can you request them to delete your data? If a patient, let's say one of your clients were to contact your scribe company, would that company give out your personal notes over to them? There are some services that offer this zero retention where basically companies, as soon as they process your data, they delete them when you're done with it. Um, on the flip side, there's some companies that say, hey, we keep that data for decades. Basically, as long as our company is in business, we want to keep your data around, which is a very big risk. Because think about that. If they ever have a breach over the entire lifetime of that company, that's that can be a lot of risk. So industry standard is roughly about 30 days as far as how long these tools suggest keeping your data around, or many of these AI tools will actually let you set that time yourself. So let's say you like to keep your session notes around for 3 months. Some tools will let you adjust that, or if you say nope, hey, I want you to delete it after a day, that's an option that many of these tools offer. So this list, of course, isn't comprehensive of everything to look out for, but the last item I want to chat about today is really understanding who they're going to share your data with. So your AI vendor, they might not be the only entity that is out there touching your data. They're probably going to be using cloud providers. Maybe they don't make the AI themselves and they're using third parties. Lots of other folks can touch your data. So one of the things that you can expect or you should expect from whoever you're getting your AI from is them to provide a list of who they're sharing your data with. The term most companies use for this is called a subprocessor. So you can go look up who the subprocessor list is to figure out where your data is going. So for something like Bastion GPT, which is for my company, Bastion Intelligence, the AI service that we built, we love what OpenAI is building. They make some really incredible models within their chat GPT, but even from day one, which was 3 years ago, we never trusted them with our data. So we have licensing agreements, which let us run their AI models, but in a way where OpenAI doesn't have access to any of that data. So in the Bastion GPT subprocessor list, you won't see OpenAI. But there's many AI vendors out there which will use OpenAI directly since it's a bit cheaper, it's a bit easier for them to do. Maybe they've got a higher risk tolerance. So definitely something to keep in mind when you're picking tools. So I mentioned facilitated over 1,000 interviews with folks really at various stages of their AI journey. Definitely heard quite a few key themes pop out that are frequently either helping people or hurting people. Definitely on the don't side, you really don't want to be pasting sensitive client data into a chat GPT or similar tools that aren't designed for that type of data. And I know it's super tempting. They're free, they're easy, the output is decent. But ultimately, if there's no BAA, they're potentially using your data for model training, not designed for PHI. If those services wanted to provide your data to say ICE agents, in exchange for some favors, could they do it? And ultimately, if you're in a place where you're using a service that's free, you really don't have the grounds to not have your data protected. So I would say the peace of mind is definitely worth paying for a proper service. The second don't. We see many of these AI companies are using AI to create online ads. As I've even personally come across some that claimed, hey, this AI is great for mental health uses, but not only did it lack the technology that it required to be compliant, it was also using models that really have no place in mental health, much higher error rates, harmful outputs. So, what these companies will do is they'll basically make a generic AI service and they'll run an ad to say, hey, are you an automotive repair technician? Here's our AI for you. Hey, are you a mental health practitioner? Here's a service for you, in order to get you to click and sign up for their services, even though they are way under equipped to be able to provide services for you. Now, on to the good stuff, the do section. I think many of you, if you use client management systems or EHRs, you've probably seen that either they've been rolling out these cool new AI features or they're about to roll out these features. Definitely encourage you to reach out to your vendor to figure out, hey, what do they have now? What's coming? But also, you can ask about their compliance posture. Um, Ask them these questions. Hey, if I turn this on, is it covered by my existing agreement? Do I need to sign a separate business associate agreement? Where's my data going? Now, for something like your EHR, they're likely going to be compliant, but we still have seen some issues with some of these EHRs. So definitely still pays to be vigilant. Now, the biggest thing I can say as far as if your EHR software has some AI capability, you really want to test it out before you pull the trigger and buy the license for it. We have seen way too many times that users get, for instance, they might get spoiled with Bastion GPT as more of a premium solution. And then they assume, oh, all AI must be this high quality. So they turn on the AI in their EHR and they figure out, wow, this is rubbish. It's useless. I can't use this after they've already put a lot of time and energy and money down to enable some of these features. So in most all cases, these EHR providers are going to allow you to do a demo. And ideally, you'll want to do a demo with real world data, not the canned scenarios that might not work like the real product would work. The other do is definitely want to look for some trust signals. There's a number of different processes that organizations can go to. So things like one is SOC 2 Type 2, which is basically a process where you bring in a third party, they check and make sure you've got a lot of basic controls. High trust is a very similar process. Um, it's not foolproof. I've seen a lot of companies that have really terrible security postures that manage to get SOC 2 and high trust, but it's still one green flag in your overall evaluation of a vendor, and at least shows that hey, this vendor takes security somewhat seriously. And then lastly, unless you are a dedicated healthcare AI technology expert, feel free to reach out to folks who have a background there. This field is changing so quickly. And so, what might have been true a month ago due to new regulations or changes in the technology, yeah, maybe there's a much better way to go about doing things, or maybe the rules have changed. So, definitely encourage you to have a resource that you can reach out to, whether it's a quick bump some ideas off of you, or even more in depth, helping you kind of flesh out what your AI journey or your practice's AI journey is going to look like. Because you definitely don't have to figure this out alone. And some of our most successful clients that we see definitely have strong partners to help them through that. I've put together a checklist of about 20 things to look for when selecting a vendor. So just as a preview, I've put the top five below. So things we chat about, yeah, will the vendor sign a BAA? Is excluded from model training? Things like that. And if a vendor can't give you a really clear, confident answer to those questions, definitely see that as a serious red flag. Within the checklist, we've identified some things that are absolutely critical must-haves, and we've got some of the things that are really nice to have. So it's a Word document. You can feel free to take it, use it directly. You can edit certain sections. You can feel free to do with that document whatever you'd like. I think we might have that in the resources page within the Whova app, or I've got a link at the bottom here where you can access that from our site. This is primarily designed for some of the smaller to mid-sized practices, individual practitioners. If you're looking to say, hey, I'm part of a bigger organization, I really want to go deep in this stuff, I'm going to hire a team that's going to be doing these types of things, you're going to want much more than a 20 thing checklist. So there's some good resources out there. NIST is a federal organization. They've put together a AI risk management framework that's excellent, but that can take hundreds of hours to go through, compile documentation and things like that. So it's definitely not a great fit for some of the smaller organizations out there. Or I've also got linked in the resources, HSI, Health Standards Institute has an AI governance document. I've helped co-author that's also really good at coming up with some of those best practices. I'll also link that in the chat as well. Okay, so we've talked about the security items. We've got a decent framework. I think we can really move on to the fun part now. All the ways that AI can go wrong, the AI gotchas. And some of this we'll go into is what we talk about, those failure modes. So even if you're using a perfectly compliant tool, high quality, things can still go wrong. I like to call these gotchas, particularly because they can really catch people off guard. The output of the AI, it can look polished, it can sound authoritative, really nicely formatted, but it's wrong, or it's incomplete, or it's biased in a way that you didn't notice it. So really understanding some of these failure modes is really what separates a clinician who uses AI effectively from one who gets burned by it. So I'd like to go ahead and walk through uh, some of these failure modes. First one being hallucinations. So this is where AI is just going to make things up. Um, it's what I mentioned, where AI is just predicting the next word. It's not necessarily fact checking itself. It really has no concept of truth. It's just producing that plausible text that in the vast majority of times it gets it right. But in healthcare, this can really show up in some dangerous ways whenever it does hallucinate. It can fabricate citations. So it might give you a reference that looks just completely real, realistic journal name, realistic authors. It's got a DOI number, but that paper just simply doesn't exist. Or it can produce some clinical content, sounds perfectly reasonable, but is absolutely clinically inaccurate. It can invent medications that don't exist, improper dosages, diagnostic criteria, all those types of things. It can also, there's also some other technologies like we call RAG, which is something that you might find like a Microsoft Copilot or many of the cheaper technologies out there, where basically you ask it for some information. Maybe you give it let's say a 500 page patient chart. Hey, I haven't seen this patient in a couple years. Get me up to speed. What do I need to know? Basically, what this RAG will do is it will break that document into about 500-page document. It'll break it in about 1,000 chunks, and it'll say, show me the 10 most relevant pieces of data. And it will then take those 10 pieces of data. It'll give you a nice little summary, which sounds great, and it looks pretty, looks like it's working well. But until you realize that there's so much clinical information behind the scenes that that particular method just really missed out on. So it's important to utilize some of those technologies that are going to be more designed for your particular use cases. It's like if you need to be able to do large document reviews, using an AI technology that's designed for that can help make sure you get some really great results. One of the other things that can really help is building what we call prompting fluency. You will, as you use AI more and more, start to develop an intuition for when AI is producing errors. Um, and it's been really great to watch people. The first week you really don't know what you don't know, and then a month into it, you're catching more and more. A year, it's been great to see some of our customers 3 years on. You develop this intuition. So it's sort of like I've yeah, known my wife for over 10 years. And so if I were to go home and say, hey, honey, how was your day? And she says it's fine. 10 years of living with your partner, you can pretty quickly understand it. Things fine, great, everything's cheery, or oh no, it's fine means there's something off. You will develop a similar intuition with AI. In many cases, it's hey, I recognize the way this is formatted, or even as you're typing out a query and asking the AI question, you can start to develop this intuition for, oh, I'm going to make a small change for how I ask the AI to try to reduce some of those hallucinations. So that is a skill that is very hard to teach, but thankfully, oftentimes just comes very organically with you using the tool. So that's hallucinations. One of the other big things that we have to watch out for is AI has we call knowledge cutoffs. So these AI models, were generally what they do is they take huge corpuses of data from clinical repositories, from the entire internet, from Reddit, from Facebook, all these sources. They're going to collect them all and they're going to build this model. And when they build that model, that costs many millions of dollars worth of computing time. And they're going to use that model for months, sometimes years. And so what that's going to do is that model basically is going to be frozen in time. It's not going to know any information beyond that particular date. So things like, what's some DSM updates, CPT codes, what's the latest APA guidance on citations, some of those things, if it came out quite recently, oftentimes the AI is not going to be aware of those things. There are some tools that basically, they empower their AI to go out and search the internet. So it can say, hey, I think this is the current CPT code that I should be using, but I'm not sure. Let me go out and ask Google, or I will ask Bing if there's been any updates. Important to note, though, that when you do that, there's not any HIPAA compliant tools out there that can utilize that process with PHI. So really great services out there like UpToDate has a good AI model where you can query those things. It's just important to read the fine print that if you are using some of these, that you should not be using client data. But we are very quickly coming to a point. I know there are many major providers out there, Google included, who are working on ways to basically give the AI ways that it can have all the knowledge of your patient and very safely go out and query some of these things from the internet. So that is coming very, very likely later on in 2026 to many of the AI tools that you're using today. And also important to note, many of these AI tools, when we talk about the training data set, oftentimes they're getting this not for just from authoritative sources. I mentioned UpToDate, WebMD. Oftentimes they're pulling in data from Reddit, from conspiracy theory forums, from a lot of places where the data is just not very high quality. So certain AI services, they basically, give me everything you've got. Generally, the services that are going to be focused on healthcare or mental health, they're going to be doing some work to say, okay, let's have this AI prioritize a little bit more data from Pearson, data from UpToDate, data from APA more than it would get from less reputable places. So um, definitely keep that in mind as you're picking some of your AI technologies. And then we also have two other items: context limits, which context limits is basically how much data can you cram into the AI's brain at one time. So if you were to say, hey, I've got a 10-page section of notes, or I've got a transcript here, give me a summary. Every AI on the market capable of doing whatever you want, summarizing, giving you its opinion. However, if you were to say, hey, I've got this client I've been seeing for 10 years, here's 500 pages of history, here's 3 hour long transcription, that's a lot of data to try to fit into the AI's brain. And all of the major AI models right now, they start to hit a limit right around 150,000 words, where basically, which is maybe around 500 pages, depending on your document size, where the AI starts to get, it's really sharp at the beginning of the document, really sharp at the end, but the middle starts to get a little bit fuzzy. So what that means is maybe if you had a really important note somewhere, or an important medication that it was really important that the AI knew, if it was in the middle of that document, once you start getting those really large documents, things can get kind of fuzzy. So you might see some AI service providers out there that it's a big rush to advertise how big of a document can you process at once. Basically, anyone who's offering more than 150,000 words, commonly we even see million word things. Just keep in mind that a lot of that is coming at the cost of increased errors, hallucinations, things like that. Or they're taking that approach where I mentioned that RAG approach, where they're basically saying, "Hey, I've got 1,000 chunks of data. I'm going to pick the 10 that I find is the most relevant, and basically ignore all the rest when it comes down to giving you a summary or giving you information." Um, Now that these limits are changing all the time. 6 months ago, it was about 50,000 words before you started to have a loss effect. We're seeing this next generation of AI model get closer to 50 to 100% better than what we had before. So continual improvement. You also have what's called a black box problem. So if you've ever asked the AI a question, you can copy that question, paste it again, the exact same AI, 10 seconds later, and you might get a different answer. And so that's really difficult because also if the AI really can't explain the way it's thinking, the way you could if you were to ask your colleague, then you have to ask yourself, okay, is this something that you could defend? So definitely something to keep in mind. You want to make sure you're understanding the output so that you're not relying on the AI really understanding that. And that really gets down to making sure you're understanding what the AI is generating. So let's say you're specializing in a certain area of practice, and you've got to maybe you need to generate something in a different area that you're not as familiar with. Yeah, you can ask AI some questions there, but ultimately, if you couldn't recognize the AI making a mistake, likely something where you want to reach out to one of your human colleagues and verify that the AI isn't off the rails. You'll also want to look at, if you are using AI, making sure that you're citing it appropriately. The APA has released and made some iterations on guidelines for how to do that. Um, in most cases, as far as regulations, citing it is mainly coming in where if you're generating something and you're not putting eyeballs on it, or you're not putting your name to that particular type of output. But we're increasingly seeing more and more regulations in the works about, hey, even if you used it to draft a summary, future regulation can potentially include the need to cite the AI that you're using. But APA goes into much more detail on their either requirements or in most cases kind of suggestions of all different scenarios where at what point does Grammarly, if you're doing spell check, do you cite Grammarly? Generally no, but if it's more substantial for certain scenarios like authoring papers, you might cite it more. Whereas if you're just drafting a note to a patient, yeah, generally not going to cite. Now, consent agreements are something we can go into a little bit later, but in an entirely different manner. But yeah, generally that's what we care about as far as citing using AI. Now, bias in AI, um, definitely very important in mental health. Because I mentioned this AI is basically learned from uh, human knowledge, scan the internet, looking at these documents. So basically, AI is a reflection of humanity, and humanity has lots of biases. Some of the things that we see, if you were to ask AI, yep, hey, generate the particular diagnosis, it might behave differently if it knows that patient is male versus female, is Caucasian versus Hispanic, is homeless versus homed, all those types of things. So we'll go into really four of the big type of biases to watch out for, and some things that you can not only use to catch but also prevent some AI from making that in the first place. So the first is what we call anchoring bias. So this is recognizing that the words that you put into the AI are really going to influence the words that you get out of the AI. And so two items here. One is oftentimes AI really likes to lock in on one subject. So let's say you're working with a client and you talked about anxiety and depression. And maybe you start out with anxiety and you maybe spend half the time on that, half the time on depression. Oftentimes what will happen with, and this is still every popular model on the market, it will latch on to something. So maybe anxiety, and it just wants to talk about anxiety. Everything is related to anxiety. That's really going to dominate all of its output. So in those types of cases where you see that happen, you can go into the AI and say, hey, I want you to give me a balanced approach. Or you can give it some additional instruction and some guidance to say, nope, hey, I want these reflected equally. Or perhaps you recognize, hey, the AI is just still has some rough edges. I'm going to ask it, hey, generate a section on anxiety, and then separately, okay, generate the section on their depression. The other item around anchoring bias is the wording that you use is going to reflect how it responds. So let's say you ask for, give me a remedy for this particular client, and you can paste your session notes. That's likely going to give you much less scientifically grounded answers than if you were to say, give me a treatment protocol, give me a treatment, because it understands the context of, hey, all the documents that it's been trained on, remedy is typically associated with less scientifically proven type things. Not always, but that small little bit of influence can help change what the type of answers that you're getting. Or if you're describing a client, sometimes you might have some quick rough notes as crazy. You might get less scientific responses than if you were to give it a, hey, this patient behaved erratically. So don't trust that the AI is going to pass it through clinical filters. There are some AI services out there, typically the ones that are going to be more geared towards healthcare and mental health, that try to filter out some of that, but it still helps to give it some solid wording to work off of. Second item is around confirmation bias. So when we looked at AI models that were generated 3 years ago, they were generally trained to be told, yep, hey, make the most correct answers. When you look at the AIs today, they're generally trained to, based on an upvote, downvote. How much did you like that response? How much did you not like that response? So AI is much more sycophantic now than it was 3 years ago. Because ultimately, all these AI manufacturers, they want you to use their AI. And so they're optimizing for agreeableness. So let's say you're drafting up some notes and you're saying, hey, I'm leaning towards ADD, or the AI does a really good job of trying to read between the lines to figure out what do you think the answer is, and that can encourage the AI to really go with what you think the answer is, and will be very build a case for what it thinks you want, as opposed to saying, hey, here's some other data points, here's a differential diagnosis. Um, and might entirely omit the things that don't align with what it thinks you want to hear. So definitely try to avoid phrasing some of that. This is also one of those skills that oftentimes just comes with time. Oftentimes you can even say, hey, I want a full clinical picture, or hey, I want you to provide me some different angles. Give me a few different possibilities here, instead of just kind of locking in on, give me your best guess type of a thing. The third type of bias is demographic bias. So unfortunately, when we look at the data that the AI has been trained on, it is going to recognize certain, it's going to be trained on certain things to know uh, um, hey, yeah, based on the they have been trained on, maybe it's highly affluent population, Caucasians. It might have a lot more data there rather than underrepresented minorities. And so we definitely want to watch out for things like, hey, one of the common examples is AI being trained to recognize different types of skin cancer. Commonly, it's how do these models are trained on white skin as opposed to with dark skin. You can see some of those issues, um, and particularly like in a mental health context, because a lot of the documentation is referring in more affluent vernaculars. Oftentimes, by using different verbiage, sometimes it can mislabel that data. There's one research study that was done where they basically took the same scenario, but they basically utilized language that was more associated with um, I think it was an African American population, and the AI, instead of labeling something as they were suffering from anxiety, it labeled as aggression, simply because AI doesn't have a full, comprehensive, proper set of data, and will oftentimes act erratically if it the data has been trained on is very different from the patient population that you're working with. So particularly if you're working with maybe particularly obscure medical conditions or diagnoses, you can really see some pretty erratic things pop up. So definitely be very vigilant and give it an extra eye. Um, the other very similar type of data is around representation bias. One of the scenarios that we've used before in the past even is basically saying, hey, review my session notes. I want you to draft a discharge order and prescriptions for this particular client, and it might prescribe an opioid. If you do nothing but change that note to say, okay, this particular patient is a homeless, all of a sudden, because the AI is trained to understand all these medical documents, and a physician's less likely to prescribe or see an active use of this particular prescription for someone who maybe doesn't have financial resources for that, the AI will then, oh, you're homeless. Okay, I'm not going to prescribe this. There was a study where I think it was AI models as of about a year and a half ago were like 30% less likely to prescribe opioids to an African American population. Um, One of the things, or we commonly see like with Native American populations, because it is again that statistical analysis, it can inject certain things like maybe nowhere in the record was, yeah, this patient suffers from alcohol abuse. But if it sees, hey, statistically, this population is a higher risk of this particular condition, it can insert that into the chart. So definitely want to be very mindful of some of those things. And then lastly, we look at administrative bias. So oftentimes the AI models, they're trained to recognize maybe higher end healthcare plans where some of the wording goes to, yep, hey, this is the best standard of care. Whereas it might not be trained on Medicare, Medicaid, that instead of looking for best standards of care is meeting minimal standards of care. So that's some of the work that if you're using the higher end healthcare AI models that they will tune and train and work to do some of that to make sure the documentation, if you're asking for a Medicare appeal or some documentation there, that it's using the language that's going to be effective. Oftentimes, how you can mitigate that is make sure you're giving the AI that background to say, hey, this patient, they're a Medicare patient, they have maybe limited or no financial resources for these types of things, so it can better understand the position that it should be writing from. And then the last of the biases is with automation bias. So we see this. It's one of the rare biases where you actually start to go more and more blind to this the more you use the technology. Um, let's say you've been using the technology the last 99 times. AI has been perfect, polished, sounds exactly like you, exactly what you wanted. Um, but that 100th time that you're not watching, you're not paying attention, that's where the AI can go off the rails, invent something, and cause some harm. So definitely want to keep a continued vigilance and recognizing that, yep, hey, at any moment, just because a computer did it doesn't mean it's perfect. So with that, transitioning to the last part, really looking at what are the real scenarios that we see folks using AI for, to help them save lots of time. Um, I think when most folks start to look for AI products, the number one thing that they're looking for, hands down, is I want something that's going to save me time or my mental load. Maybe it's doing appeal letters. Maybe that's the thing that just sucks all the life out of you. You can't stand it. Yeah, that's generally how folks start. Over time, we find a lot of times that balances out a little bit more with, wow, I'm a better clinician. I'm a better mental health care provider, administrator, because I'm using the technology. It's writing better, it's communicating better than I could ever myself, when you partner with AI. So um, everyone starts at a different point in their journey. We generally recommend working on those things that are going to be huge time savers for you, but relatively low risk. So often things like, hey, I'm about to submit this document to insurance, or hey, I'm about to send this patient communication, I'm about to log this note in the chart, asking it to proofread it. Hey, what did I miss? Or if you find there's certain things that you're maybe commonly making mistakes. So maybe it's like, oh, I'm always mixing up names, or maybe as part of my practice, we really want to use non-gendered pronouns. You can encourage the AI to recognize some of those things to help improve your documentation. That's really helpful for folks, particularly who are like, yeah, I don't know if AI is, if I should be using AI or not. It's a good kind of first step to dip your toe in the water, before eventually folks often will get to the point where they feel like AI is absolutely part of my standard of care. And they don't feel safe if they're not using AI to check their work. Um, Commonly, from an administrative standpoint, we receive a lot of kind of panicked calls of, I'm about to go on this audit. I need to review my policies. I need to review some of my sessions. Help me understand what, or maybe I just need to do a random sample, or hey, it's AI, it's cheap. Let's just review all of our documents, looking for things, whether that's in general or maybe hey, we're about to get an audit on our worked with the client on their use of restraints, and so you can basically give. In many cases, AI is already trained to know some of those requirements, but you could also upload your documents, give it to the AI to educate it on what's going to be possible. Or even as simple as like, hey, I just saw this client. They've got these 20 issues that we work through. Draft up some education that's tailored just for that particular patient. Instead of having to use generic that maybe as a whole together they don't make a lot of sense. They're not very synergistic. With AI, you can generate that in a matter of seconds. Or even from a note-taking standpoint, we had one practice, they're a faith-based practice. So they generate one set of notes that is for the provider. It's very technical. They don't pull their punches. They've got one document that goes to the patient or the client, and they have the religious affirmations. They've got it's a layperson could easily understand. And the third document is going to insurance. So, and previously you wouldn't have time to create three distinct separate documents, but with AI, if it takes you an extra half a second to generate that, it's one of those things that's oftentimes for folks really a no-brainer. And then over time, you can utilize some of those scenarios that might be a little bit higher risk. So, hey, maybe now I want to take a session and generate all of my progress notes from scratch instead of, hey, I've given the AI an outline or I've given it my rough notes. I just want you to polish. You can gradually, as you start to recognize these biases, more easily recognize hallucinations, figure out how you can best work with AI. That's when we generally recommend you transition. Some folks that transition takes place over a matter of a few days. I think for most folks, they find even weeks into it, they can start getting the more advanced things. Some folks, this might be a multiple year journey, but there's lots of resources out there. I think at the end, or I'll paste in the chat some additional resources that you can go to become more well versed with some of those technologies. And then there's still some technologies that um, definitely recommend avoiding just because the technology is not there. So oftentimes we're looking at, yeah, what are these bots that can, in a scenario, patients can go to figure out like, hey, do I need to go to the emergency room for this or not? Um, there's some cases where that can be appropriate, but in most cases, the technology is just not quite ready yet. We still want to have a physician in the loop there and drafting it, and ultimately the physician's the one putting their name next to it and clicking submit. So, so I think with that, lots more content to go into, but I want to check in with the room and ask: is there anything we hadn't touched on? Any questions in the chat? And I think we did have, I think there's one question. So someone asked, what are some AI programs I would suggest that are HIPAA compliant, i.e. notes with intake process, et cetera. So I think we touched on that a little bit earlier. Ultimately, yeah, check with your client management or your client management system, your EHR. Obviously, I'm really biased with Bastion GPT, and that me and the team we've developed that. Um, we're at over 8,000 facilities. Just about half of those are mental health facilities. So a lot of the work that goes into building that product is designed specifically for mental health practitioners.
And we love it. We've been using it. We love it. I think it's a great product. Also a little biased, I guess, in that way too. Um, Well, perfect. If we're about out of time, so I know there's a Trainual has something coming up next at the top of the hour. So I just want to pause and say, definitely thank you, Josh, for your presentation, for everyone being here. And if you have any questions, definitely go check out their booth. They have everything set up in there, some links if you want more. We use it SVP, like I said, and so if you have any questions, feel free to ask me, and I can pass it along if I don't know the answer either.
Absolutely. And also, yeah, in chat, I put a link to some of those resources. Some like that Coursera, we've got no affiliation. We've just seen that's a really good program. If you find like, hey, I want a 20-hour, give me a course. It's free to get a little bit more comfortable with the technology, something that you can learn. Feel free to connect with me on LinkedIn if you've got any questions. Always happy to either help you out myself or point you in the right direction.
Awesome. Well, thank you, Josh, and thanks everyone for being here.